agents as well, immigration agents. Here is the story off the AP. Arizona lawmakers want to widen Arizona's illegal immigration crackdown with a proposal that would require hospitals to check whether patients are in the country legally, causing outrage among medical professionals fearing that becoming de facto immigration agents under the law.
That's exactly what they'd become.
Healthcare is a pretty intense industry. You have to be focused. There's high demands on you all the time.
Well,
physical, emotional, mental.
Yeah, and the medical industry, it's already under enough scrutiny as it is, henceforth why we had to have a new immigration or a new healthcare plan. So, so it's not like the medical industry hasn't been, getting its share of flack, but now they're being asked to be, if you're treating somebody for a head wound, make sure they're American, will you?
At least they're in Arizona. This is their idea, but, like a cancer, it starts out there and then it starts spreading across the country as other people who do not like, particularly Mexicans. Let's face it, that's who it is targeting. On the line with us is a doctor from Arizona, Dr. George Pauk, and he is with Physicians for National Health Program, and he has some strong feelings on the issue. Welcome to the program, Doctor.
Hello.
Yeah, you're right in the eye of the storm there, and you have spoken out. Of course, doctors don't have to speak out. A lot of times it affects, their integrity. They don't want to get involved politically. But you have said that this is going to be damaging to the healthcare industry, haven't you?
Yes, it sure is. It is going to cost hospitals and emergency rooms a lot to actually add more personnel to be checking the immigration status and reporting them to the federal police when they find them. They can treat the person, but then they have to report them. And it is a disaster as far as medical ethics, nursing ethics, and all healthcare workers are terribly frustrated by this vindictive move by our politicians.
This is just another salvo against, let's face it, it's the Mexican population there. This is a way to make them feel uncomfortable, unwelcome. They're being hunted, and now they can't even go for medical services, even if it's an emergency. Pretty much, if they don't have health care insurance, just like folks who are citizens here, if they do have an emergency, that's what emergency rooms are for, right? Anybody who is in a life-threatening situation.
It's trying to catch undocumented immigrants, migrant people when they are sick, when they have to come out for help. And our ethics of the healthcare profession do not allow us to do that. We have to practice so that we do not harm our patients. We have to act as if in confidence with our patients, that we protect their privacy. And so this misguided attempt of our legislature to put this into law is going to create a real bad dilemma for many health professionals and hospitals. We're opposing it. We're having demonstrations. The hospitals are coming out against it finally, and we hope to put this down. But it shows the spirit of exclusion, of persecution of good people who contribute an awful lot to our country.
Absolutely. And of course, Doctor, they make the argument that, well, these illegals are coming here. They have no way to pay for the services. It's costing our society, our hospitals, a tremendous amount of money. And then, of course, that's passed on to all consumers. But in fact, you can't just go to the emergency room for anything. You have a splinter, you have a sprained ankle. You just can't go. The very first thing I've noticed when you go into any kind of hospital or healthcare service, what's your payer source? Do you have insurance?
Right.
Do you have a credit card if you don't have insurance? How are you going to pay for this? And they do turn people away, right? If something is minor and not health threatening and they have no way to pay, not everybody gets serviced.
Sure. Actually, the immigrant population is healthier on average than the American public, and they use healthcare facilities much less. They actually use it probably a third of what the average American uses it. And also, this real kicker here is that the undocumented immigrants and immigrants in general pay taxes. They pay more taxes than they use in social services in the United States.
Wow, there's something you don't learn every day.
Well, that just makes sense, especially if they're not being paid under the table, they're being paid with a check. Then that means taxes are being taken out of their check every year, but they can't file taxes to receive that back. So the government gets to keep all the money they've been taking out of their check. And they don't.
Nice little deal that they've worked out there, haven't they?
Yeah, actually, we're on the plus side because they're not making that much money. If they could file and get it back, they would get it all back. But the government gets to keep it every year. Plus, they're paying a tremendous amount of, as we all are, in sales tax every time they purchase anything.
Isn't it kind of sort of like a Ponzi scheme, really?
Well,
it is a scheme nonetheless. In an abstract way.
Right. So this idea that it's costing the public a lot of money is really not true. And really, you don't really hear people in the healthcare work complaining about it, right? Are hospitals really screaming about the fact that we're going to have to shut the doors because there's too many illegals coming to our hospitals?
No. That's certainly not true. We are find these people. They're gentle, kind, hardworking, family people, and we don't do things to try to break up families like our sheriff and so forth is doing. It's just that's an anathema, or impossible for healthcare workers to contribute to.